Before each bite, remember to get your needles set up perpendicular to and in the tip of the jaws of the needle drivers, grasping the needle about 1/3 to 1/4 of the needle length away from the swage. When closing the skin, you should ideally close just the skin layer. What I mean by that too is to avoid all this deeper sub-Q tissue and just get your needle passage to that thin dermal layer there. Remember to stay mindful of tissue handling and not to crush tissue if possible, and manipulate it with gentle grasps and rotations or a closed instrument, but you want to avoid heavy squeezing like that because you can damage the tissues. A needle pass is essentially made up of a stab and then a rotation of the wrist. And so I find it's easiest to learn this if you split that up into this initial stab and then worry about rotating your wrist and having a precise exit point. And you can see here we're getting that precision right through that dermal layer. Okay, so I'm going to bring it up here. You can see just in the dermis, I'm not capturing a bunch of that sub-Q because right now I'm doing this interrupted just to close the skin layer. Now, you take your needle out in the middle of the incision there, and this can really help improve your accuracy with your opposite side needle placement rather than trying to make the throw all the way across. So here's that stab initially into our dermal layer to give us that nice precise location point for our needle tip. And then I want this to be about the same distance as from the skin edge as it was on the other side. Let's try and keep it as consistent as possible, and that's pretty good. Now remember, in order to tie square knots, you want to be between these two loops. You don't want to come from the outside and wrap and then bring it in. You need to be instrument between the two, wrap it, and then pull tight and repeat. When you're learning, it can be a challenge to prevent yourself from over-tightening the suture on the second throw. So here's a technique that can help with that. When you want your suture to be tighter, you pull parallel to really tighten up that knot and get some suture slack out. Once you're ready to lock it though, you should pull up kind of 30 degrees like this, so you can see. Pull parallel when we want it to be tight, pull up about 30 to 45 degrees, give it a quick tug, and that usually will lock your knot in place so that then it doesn't slide down anymore on you and strangulate your tissues. So you'll just throw a regular square knot on top of that to finish your interrupteds, and you cut a long tag. Next, we'll demonstrate a cruciate pattern, and my pinky's about 1 centimeter, and if we're going to go 3 to 5 millimeters away, that can help me estimate where my next bite should be. So I got my stab, and now I'm able to fine-tune my rotations to see I'm kind of in the sub-Q there, so I'm going to back out a little bit, and then rotate my wrist until I'm happy. And I'm right in or just under that dermis. And then what I want to do is enter that exact same depth on the opposite side, directly across from it. So I'll peel my skin edge back gently there, and I'll stab to get that precise dermal placement, rotate my wrist, get my needle out, and then for the cruciate, you essentially will just do the exact same thing. Give yourself another 3 to 5 millimeters distance and repeat your needle passes. You're going to stab, rotate your wrist, get it right into a superficial layer where you'd like it, and do the same on the opposite side. So you're stabbing in right into your dermal layer, so you know you have that precision, then worrying about rotating your wrist. When the needle exits, make sure you don't grab it through the loop there, and you kind of come from the outside to grab the needle. So now you have your cruciate in place, and you're getting ready to tie it. So you'll wrap and pull it pretty tight, about where you would like for it to be. Okay, it's going to spring open on you a bit. And then your next throw, this is again where you're going to do, you'll pull parallel until you're happy with how your tension is, and then you'll give yourself a little bit of a 30-45 degree tug, and that should lock your knot in place and prevent it from slipping down further on you when you throw subsequent throws. So we'll put another square knot on top and cut our tags long. To make sure sutures aren't too tight or too loose, you should be able to gently slide a small instrument like a hemostat under. And you can also apply gentle pressure on either side to make sure the skin edge isn't opening up. And you can see kind of on that corner there, it's opening up just a little bit, and so that tells me, hey, maybe I should put an interrupted suture there. So it's a good thing to do while you're practicing and learning how tight and how loose you need to make things. Looks like there's some room for swelling too. Next, we'll demonstrate the horizontal mattress suture. Because this is an everting pattern and not an appositional pattern like the previous two, greater tissue bites are taken each time, including subcutaneous tissues. These larger bites allow for the eversion to take place and tension relief on the closure. So the first pass of the needle is just the same as your first two, only for the horizontal mattress, you reverse the needle in your instrument and then go back the opposite direction. And again, these are about spaced out 3 to 5 millimeters apart and 3 to 5 millimeters from the edge. You'll see as we tighten this down, it has a natural tendency to evert the skin. So you can see it curling up and out there. Place our second throw and another scoring out on top to lock it in place. From this angle, you can really appreciate the difference between the appositional and everting patterns. Next, we'll show the vertical mattress, which is also an everting pattern. So we'll take decent bites of tissue on either end. And just like the horizontal mattress, we're going to grab the needle and reverse it for a backhanded throw. Only rather than advancing first, we're gonna pass the needle in the exact same plane. So it's going to be along the same lines. And this is a pretty big bite, a needle bite, for me to take both edges like that at the same time. So oftentimes we have to come out in the middle of the incision to perform one of these vertical mattresses. So we tie like normal, and you can see when it tightens, it's going to evert those skin edges. The vertical mattress allows for a little bit better blood supply to get to the skin edge. Just because of its orientation, you can kind of see how the horizontal mattress may prevent blood flow, small vessels, from reaching all the way to that skin edge there. And again here you can appreciate how those are everting and the other two are just appositional. These 4 patterns will give you a good foundation to build upon during the rest of your surgical education.